that you can pick up if you haven't already, or maybe you've gone online to see all the topics. We try to change those up every year to give, different kinds of information to the community. It's free, as you know. So we're thankful for the partnership, and thank you for coming. We welcome you in person, and we're also thankful for all those that are online on the Zoom. We've got folks in Ohio, we've got folks across the country, and we've got folks across the world that are joining us tonight. So that is exciting to have. And I'm Maria Solser. I'm an outreach specialist. So my job is to go and grow the awareness for all the treatment that we do at the Lindner Center. And I'm going to give you just a little overview of that. Some of you that come all the time, I expect you can probably repeat this, and you know a lot of what we do, but we do like to share this. So when we're in the neighborhood, we're in Mason, the Lindner Center, home about 15 years. We are 15 years old this year, nonprofit. We have 80 beds, and what that looks like would be 2 16-bed units for inpatient. So that would be acute care for adults 18 and over. From there, on that continuum of care, we have partial hospitalization. We have IOP for addiction and co-occurring. We also have a full outpatient practice for adolescents and adults with psychiatry, psychologists, therapists, nurse practitioners. As well, we have a neuromodulation, working with treatment-resistant depression, 18 and over. We also have a full continuum for eating disorders. So inpatient, partial hospitalization, IOP, which stands for intensive outpatient, and then outpatient, the Harold C. Schott outpatient eating disorders team. We have residential units that are 16 beds each. One is called Williams House. That's where folks come in for stabilization. We can do detox, medication management, and an evaluation to really evaluate what is going on. And then Sipsey House, 16 beds. This is all under one roof, Mason, Ohio. Sipsey House is a comprehensive diagnostic assessment. We're surrounding the individual with a team, psychiatrist, psychologist, social worker, and we're teasing out what's going on. We want to figure out what is going on, provide diagnosis, and then make a recommendation for next steps of treatment. One thing we do, and we do have folks come out from all over the world to our residential. Also, we have something locally that we offer, a rapid access service. That's where, with psychiatry at times having been hard to get into, we created this program called Rapid Access. Folks can make an appointment on 2 afternoons a week, Tuesday or Thursday. They can come in, see a psychiatrist, a social worker, get a recommendation for treatment, get medication if they need it, and they can come back for 3 bridge appointments. It's not their ongoing psychiatrist, but it was created to help bridge that gap because of people having to wait to get into a psychiatrist that need to, and we don't want them to decompensate and then have to go to the inpatient because they're having to wait. So that's a local program that I'm really proud of at the Lindner Center. I think it's been well supported and needed. So also Children's Hospital is on site. Of those 80 beds, Children's Hospital has 16 beds for adolescents for inpatient that they manage at the Lindner Center, and also a partial hospitalization for adolescents. So on site at the Lindner Center. I think that gives them a good overview of what I try to help educate the community about and try to help connect folks to. And if I can ever help you, my card is on the table. I'm happy to come out or be of support if you want to call me. That's enough of me. I'll go ahead and turn you over to Dr. Megan Schrantz. She works in our outpatient and residential departments at the Lindner Center of Hope, and she's here to help us learn more about the impact of trauma on child development and well-being throughout the lifespan. So I'll give you to Dr. Schrantz.
Thank you. Can everybody hear me okay? Yeah. Okay, so I have been instructed that there's the camera for the Zoom folks is kind of like right here. And I'm usually the kind of person that wanders when I'm doing a talk, but I can't really do that. So I'm gonna be a little bit by the podium, which doesn't work really well because I'm not that much taller than the podium, but I might be able to do this a little bit, but I'm gonna do the best I can so everybody can hear me and see me. So I'm really glad everybody came out tonight. I was sort of thinking that we might not have as many people because of the weather, you know, that people might want to take a little dinner time stroll in the nice warm weather, but I really appreciate you being here tonight. I'm going to tell you just a tiny bit about my experience, and it just backs up why this topic is so important to me. I have about 34 years experience as a therapist, and a large part of my career has been working with kids. I spent 20 years working at a juvenile court facility called Hillcrest Training School. And I worked with all the kids there were adjudicated and they had to stay there, and it was residential. And that really opened my eyes to a lot of what kids struggle with has to do with trauma. I also worked at a children's advocacy center in Northern Kentucky, which works with kids who have been involved in a crime. I was a therapist there. Kids there generally were sexually abused, or they had witnessed a crime or something like that. So I've been at Lindner for about almost 7 years, and I work with kids and adolescents, and I also work with adults. And so I have really had the opportunity to see how trauma kind of works its way through the lifespan. I've worked with adults who have been, will tell me about their childhood trauma, and you can kind of see how it shows up in people as they grow and as they get to be adults. So I just think it's a really, really important topic. I'm also glad to see that there's some kids here. Super excited about that. I don't know if you had to come or if you wanted to come, but glad you're here. So this will be, even though I'm sort of tethered to this podium, I'd like to make this fairly informal. I'm going to give you a lot of information about just the impact of trauma on children and as they grow, and kind of why it happens, why trauma can kind of stick around with folks. And so I'll pause every once in a while. You feel free to ask questions. I think everyone on the Zoom call can ask questions too by typing it into their little chat. So that'll be good. Okay, so let's get started. So let's talk about just sort of what we're gonna, just an overview of what we're gonna do this evening. So I'm just gonna define childhood trauma and what post-traumatic stress disorder is, bearing in mind that you don't have to have post-traumatic stress disorder officially to actually benefit from trauma-specific treatment. There's a lot of people kind of walking around with wounds that may not fully, qualify as post-traumatic stress disorder, but it's still really important because it can, it just impacts the rest of their lives. So we're going to talk about that. Going to specify, talking about the various effects of childhood trauma as kids and adults. And then we'll talk a little bit about effective treatments for post-traumatic stress with kids and adults. And so that kind of gives you a good idea about maybe if you or someone you know is seeking out treatment, that what you might want to look for. Okay, so we think about what constitutes childhood trauma. There's different things that happen to kids. And one thing I want to point out now, I think I have it on the slide like later on, but one thing I think is really important to point out is that when you think about when bad things happen, they don't just have to be like something that really stands out as traumatic or maybe a singular event. A lot of times, kids, people when they're growing up, they might experience kind of an ongoing lighter weight kind of experiences that are just not really in their best interest, and that counts also as trauma. So when we think about just having like maybe a lot of conflict in the home, or maybe wherever a child is living, it's not safe, or maybe there's there's just like, I don't know, there's like maybe substance abuse in the home. There might not be a single event, but maybe kind of an overall experience can also add to trauma. So I just want everybody to keep that in mind too. So when we think about childhood trauma, we think about abuse. Those are kind of the obvious ones, right? Sexual abuse, physical abuse, emotional abuse. We think about any kind of domestic violence in the household. Think about a child going through this themselves or witnessing something. That's really important. And obviously, I'm thinking about, I'm sure everybody's thinking about the shooting that happened at Michigan State 2 days ago, and how there were so many students just barricaded themselves in their room for like an entire night, just terrified. So even if, I don't know, even if they didn't see the shooter, they were not injured by the shooter, that is definitely, they were there, right? They witnessed that, they experienced that. School violence, that's up there. Sometimes kids will feel traumatized by something they've been through physically, like if they've had scary medical treatment, they've had an accident, if they had a really bad dog bite, something like that. One thing that I think we don't really think to ask is if someone has been through a natural disaster. I don't know, I'm guessing if I asked you guys that, some people might raise their hand, like if you've ever been through a hurricane or a tornado or a fire or a flood or something like that, that was really upsetting. Death of a parent, a sibling, exposure to things like war, terrorism, refugee status. These are all things that can be behind childhood trauma. Does anybody want to add to that list just from their own experience, or people that they work with, people that they know? Any questions about that? Feel free to raise your hand.
Pandemics.
Oh yeah, pandemics. Oh my gosh, yeah. Let's not even get started on virtual learning for kids and just families all being together. Yeah, online learning is not good. I think we're gonna live with that for a long time, aren't we? And also the loss of life and health that comes with pandemics, that we all know somebody probably who was impacted in that way. Anybody else?
Being homeless.
Homeless, yes, not having a stable place to live, for sure. And then that would make it more likely that a person would run into all kinds of other stuff that they wouldn't normally, everything out in the community, on the street, all kinds of dangerous things. Yeah, not being cared for. Wonderful. Anybody else want to throw something in?
Just from the chat, Doctor, they've said that one of them could be international adoption.
Okay, depending on how that is facilitated, like specifically like what happened before, during, and after, or?
Question is simply, can you just talk about trauma and international adoption as related?
Okay, when you think about that, when we can think about like the time of a baby's life when they are really attaching and they need like a person there, and if that's not there, that can really impact the brain development of the child, the attachment, their feelings, like can they trust other people? That can definitely happen. That has some, and we'll talk more about that, about brain development with trauma. Yeah. You guys ever heard of failure to thrive? Yeah, that's like, babies could actually die if they're not held. Definitely trauma. Anything else? Anybody anything else on the chat?
Just
Thank you. Thank you. Go ahead.
Generational.
Yes, generational trauma. And I'm definitely going to get to that. And there's some really interesting research coming out about what we call generational trauma. So that is, it's kind of like, it feels like it's inherited almost, or there's just like it's passed down in families. And there's actually some new research coming out that it can be inherited. Like if a mother has trauma, during the gestation, that it can change how the baby develops. So some interesting stuff. Okay, go ahead.
One of the other ones they said is like, as opposed to what you have on the screen here, but just a long-term illness.
Yes, yeah. So there's all kinds of different things that can happen to kids that can lead to trauma. Yes. Absolutely. So that's a really great example of probably like an ongoing trauma with acute traumas built in, like maybe they had to have some kind of medical experience that was painful or scary, and then just kind of the ongoing day-to-day living with an illness. Yeah, it can really impact how that person sees themselves and others, the rest of the world.
One thing that stands out for me is like prenatal trauma. Like, I know a lot of kids that I work with that have been adopted from like 1 day old and they never knew their biological parent. And they're adopted to families who take pretty good care of them. Yet they experience trauma from like some of the effects of the things that mom did during pregnancy. Did that with drug abuse or like you said, domestic violence or sexual abuse in their home, but sometimes that trauma still impacts these kids, even when they never lived in a home with bio parents.
Yeah, like they're left with that just at birth, those effects on their prenatal development. Yeah, absolutely.
Parental neglect.
Neglect, yes, which is, again, sometimes when stuff like that happens, it can be kind of like a big thing or a little thing, but it's still a thing. And sometimes kids will just acknowledge like, okay, this is just how things are in my family, but that doesn't mean that it doesn't impact them in different ways. And we'll talk about that as well in a second. Yes.
What happens if a child, let's say a child is gay and the father doesn't even want anything to do with the child? And the child has to move to another household or move away or find an apartment or something. I mean, I think that could traumatize a child.
Absolutely, it's that attachment with that parent, just as being validated as a human being. Right. Yeah. Okay, take a couple more and then do you have any more?
They just had a list, Doc. They said, as I mentioned, the parent illness, they have human trafficking, when a parent commits suicide, forced migration, we already talked about COVID, or just divorce.
Divorce, yeah. So, some kind of instability in the home, yeah, and human trafficking is real and right under our noses and very terrifying. Yes, thank you. Okay, so when you think about post-traumatic stress disorder, there's a cluster of things that go together. So there's obviously the adverse event or events that have occurred, and directly related to that, there are a cluster of things that happen. So like kind of having memories when you don't want to have memories, like as if someone is knocking on the door in your brain and saying, remember this, and you don't want to, popping up in dreams. With kids, you often see kids acting this out in play, just on their own. I remember my son around the 9/11 attacks. So he was 5 when that happened. And then like a year or two later, just out of the blue, I wasn't playing like, therapist or anything. He just started making these amazing oil pastel drawings of flaming twin towers with the airplanes going in. And it was just like, I don't think he was necessarily traumatized by 9/11, but I think as he grew, he started to understand it more and he had to figure out what this was. And that's just what he did. And those were like some really amazing pictures that he drew. But it also brings up another point. When kids have trauma, when they're younger, they will experience it in different ways as they age. So, for example, say there's like a 6-year-old who experiences sexual abuse. How they experience that at 6 or how they think about it when they're 6 is gonna be a lot different when how they remember it when they're, say, 16. You know, when they're 16, they'll probably be even more like, oh my gosh, I can't believe that happened to me. And it's not unusual to have to process it all over again, even if they got therapy when they were little. Yeah, so as we grow up, we think about what's happened to us in different ways. And just because based on brain development. Okay. So, memories, dreams, play, getting really distressed when there's a reminder of the event. And so that's not really something that anyone does on purpose. It's kind of like, if there's some kind of a reminder and it frees up, or you want to run, or you just feel terrified, that's kind of like a recurrent, your body is remembering. With that, who would not want to avoid that kind of stuff? I mean, everybody would want to avoid how bad that feels. So that shows up in different ways. It could be refusing to go somewhere. It could be, okay, I'm not going to think about it. I'm going to do something else. I'm going to play video games for the rest of the day or the month. It could be with older kids. It could be substance use. It could be being on their phones
I
too
don't
much.
understand what was the reason, like why were they talking about each other's parents?
Okay. So involuntary memories, avoidance of things that bother them, feeling like you don't see yourself in the same way or other people in the same way, you don't think about or feel things in the same way. This goes along with, like, examples of this are not being able to trust people, being really wary of the situation at first, seeing yourself as bad, feeling ashamed, feeling like you're responsible. And then there's changes in just how your body is. So we always think of trauma as always in the body somewhere, and this can show up in different ways. It can show up with being irritable or angry or super hyper or always looking over your shoulder or something like that. And this is the thing that most people don't necessarily at first make a connection with. It's kind of like, okay, why is my kid acting like this? You know, why is he so angry? Why is he, I don't know, out there doing crazy stuff? And it's just like that traumatic stress is in his body, and that's just what it's doing. So, and that's actually one avenue of treatment is through the body, is helping people with calming themselves and being able to manage that. Any questions about that?
Yeah, I'm just curious, so when if you aren't aware of it in someone else, but they aren't aware of it, right? Like, how do you bring up to them that some of these things that you're seeing, it could be because of that, and it's trying to uncover it? Like, how do you go about that?
Is this like someone you're working with, or just like a person you know?
In general, like if you start connecting the dots, like maybe there's more going on here because there's changes in emotional reactivity, irritability, etc. But they think everything's fine. How do you uncover?
It's tricky because there's overlap in symptoms that people have, like irritability also goes along with depression in kids, teenagers, and sometimes adults as well. So I would say just, if you feel like you can, maybe kind of just ask them. You know, it depends on your relationship with that person, I guess. I'm not sure if that fully answers your question. It's tricky because there is an overlap.
Right, and if
Yeah.
it's something that's a reoccurring issue from their past and it never was addressed, how would they realize that it's really PTSD that it's dealing with?
Yeah.
Okay.
And you don't have to really put a name with it if that feels uncomfortable, but I think it could be avoidance if that person is just thinking like, no, that's done. Don't have to worry about that anymore. For fear that opening that up, it might just be like, too much. I think validating what people experience, maybe asking them can be just a nice thing. I think everyone would like to be validated for what they've experienced.
But symptoms for children with PTSD, is one of them physical, like pain? 'Cause I know children sometimes experience other types of mental illness symptoms in a different way. So does this one have those physical aspects too?
It can. So, yeah, trauma is usually in the body somewhere. And that can include pain. It can even include things that seem like, wow, did that really happen? For example, some people have seizures because of trauma. Some people have very unexplained things that happen in their body because of a traumatic experience. Hold on just a second. I actually worked with a young man who for a little bit actually lost his ability to walk. He was in a wheelchair. And then one day he just got up and started walking again. So that's called functional neurologic disorder. But pain, I think just aches and pains also very much. You think I talk all day as a therapist, this wouldn't happen, but, okay. So PTSD, what you'll often see, just kind of as a general thing, fear, anger, depression, avoidance, and a lot of difficulty just dealing with day-to-day stress, maybe being a little touchy, walking on eggshells, kind of a thing. This might be what you see on the outside in a general way. I'm going to talk a little bit about something called the ACE study. ACE is an acronym that stands for Adverse Childhood Experiences. So in the late 90s, there was a study done by the CDC and the Kaiser Permanente group where they had adults come in just to the regular doctor and they had them fill out a form. And the form had a list of like any of these things that happened to you when you were a kid. And I'll go through the list in a minute. So they had like a ton of people. They had like well over 100,000 people who filled out this form. So they were really able to put it together as like correlating it. And it turns out that the more adverse experiences that they had as a child, the more physical health problems they had going to the doctor as an adult. It's a really interesting study. So on this, of the over 100,000 people, so 2/3 of the adults had at least one adverse childhood experience, and about 20% had 3 or more. And generally the trend was, the more stuff you go through as a kid, the more physical health problems you're gonna have as a grown-up, or possibly have, which is kind of connects with the physical pain idea. So there's definitely something going on with your body growing up that this happens. So here's what was on the list of adverse childhood experiences. So emotional, physical, and sexual abuse, things in the household, like if your mother was badly treated, violently treated, if there was substance abuse, if there was like an adult who was mentally ill in the house, like in a way that wasn't being treated properly and that adult really struggled. Parental separation or divorce, family member goes to prison, or gets arrested, is separated from the family. Emotional and physical neglect, including medical neglect, like never get taken to the dentist, don't go to the doctor when you're sick, break your arm, don't go to the emergency room, that kind of stuff. Yeah, so this is what was on the list. So it turns out those adults, when they came in to their doctor, if they had almost like a ton of people, 2/3 of them had at least one of these, and 20% had 3 or more, which greatly impacted their health. I'm going to talk a little bit about complicated grief in children. Because grief goes with trauma, I think, sometimes. Okay, thanks. So sometimes, when a child experiences a loss, it can be kind of like, I don't know, uncomplicated. I'm gonna show you that one. So uncomplicated is like, child feels empty and sad, they miss their person, but the sadness kind of decreases with time. And the child is able to incorporate all the good stuff about that person into their memory, into their mind. And they have positive memories. So complicated grief is more traumatic. This can be kind of considered part of post-traumatic stress, is that there might be, it might be an accidental death, it might be a very violent death. The child may feel like somehow that they were responsible or they could have done something. When a child starts really having thoughts like that, that's when things get to be complicated. It could happen in a range of like a bunch of other stuff in the family. And that would be a complicated grief kind of situation. Yeah. Does anybody have any comments about that? Just noticing that or having experienced anything like that, where grief is just really hard to get over and maybe just kind of keep going in life?
It doesn't have to be death, or does it? Can it be just a loss in general?
It can be a loss. Yeah. Yeah. It can be a lot, definitely be a loss. Okay. So when you think about grieving for kids, and I guess anyone, kind of the tasks of grieving are experiencing the pain, accepting the permanence, which for a little kid is hard because they're not quite there yet, but really just kind of understanding as best they can, being able to reminisce about the person and kind of take them into their life. But a lot of times this is interrupted in some ways. I'm guessing that the people who lost their loved ones at Michigan State are probably going to have some complicated grief. There's going to be a lot more to it than just a simple loss. Okay, I'm going to take just a second for any questions so far. I'm talking a lot. Yes.
Is there such a thing as like spiritual trauma? Like being, I guess, religion. What's that?
Mhm.
Can you repeat that, Doctor?
I will. So the question was about, is there such a thing as spiritual trauma, specifically being forced into a religion, practicing a religion that you don't accept? I think it's important to think about trauma I would say yes, because trauma I think can be individualized for each person. Some people have some big stuff happen to them and they're really okay, or so-called big stuff. Some people have other stuff happen to them and they're really not okay. And we're not going to judge that. We're not going to judge who should have trauma, who shouldn't have trauma, or if it was just, spiritual trauma, it just is. But when you think about trauma, it has to do with changing how a person sees themselves and the rest of the world. Generally, a person who's really impacted by trauma sees themselves in a negative light. And they feel unsafe, powerless, and responsible. Those are like the three main areas. They feel like, okay, I don't have control, or I didn't have control, so I don't have control now. I don't feel safe in places where I should feel safe. And I feel like something was my fault, or maybe I've been damaged by this. So when you have those kind of things, then I would say yes. Okay, here I am. Okay, so think about kids. Okay, so how does this work? How does going through bad stuff as a kid, how does that change how people grow up, and what impact is it having? So you can kind of split it up into different areas. So we think about the attachment disorders. I had some questions about adoption earlier, international adoption. Attachment disorders can happen in a variety of situations, but it's like the child not feeling like they have really attached to an adult. So it makes it really hard to trust other people. It's so basic in our lives that when we're a baby, we get somebody to hold us and to attach to. If that's interrupted, and it's not for everyone, but if that's interrupted, it can lead to a lot of other things about how that person may interact with the world. Having like poor boundaries in the family, that can happen with attachment. Sometimes a person will have trouble setting good emotional boundaries for themselves. They might not feel as much empathy as maybe another person who did, like not as much caring or being able to put themselves in another person's shoes. And here's the transgenerational, this is transgenerational mistreatment, but trauma can be transgenerational, not only by what you see, what you observe in the family, but even through the prenatal development. So that's why trauma kind of, I don't know, it turns up in families through learning and also through development. So there's attachment, there's biology. Trauma can impact brain development. Think about babies. I mean, they're new at everything, right? And their brains are developing so fast. And if something interrupts that, that's really upsetting, it also kind of changes the way their brain develops. And sometimes it looks like hyperarousal, like the child can't settle themselves, they can't focus on things. Sometimes there's more like physical pain, illness, somatic complaints, and that can actually be real. That those things really do develop in the body. We think about emotional regulation. So that's how like you kind of deal with stress, express yourself in a way that's either like kind of chill or kind of off the wall, so to speak. Kids who've been through trauma have higher rates of depression. They have more irritability and anger. They have trouble figuring out actually what they're feeling. So part of trauma treatment therapy for a child is helping them figure out what they're feeling. There was actually this one study, and if you've taken an introductory psychology course, you've probably seen this. But there was this study where they had this face of this woman, and the child was supposed to figure out if it was an angry face or a sad face. And it was the same face for every kid. And the kids who had more trauma would see that as anger more than as like sadness or fear on the face of that person. So actually interpreting how other people are changes for that child. Sometimes kids use drugs and alcohol to regulate their emotions because their emotions don't feel like they can't do it on their own, or they don't feel like they're in their body, or they feel like things aren't real. A lot of times I have kids telling me like, okay, I just feel like where I am is not real. And it's really hard for them to describe it, but that's just kind of how they feel. Dissociation is the thing where you kind of zone out. It can be on different levels. So sometimes we zone out when we're watching a really good movie. Sometimes if something scary happens and we remember something else, we really zone out. Like we're just not here for a minute. That's dissociation. And that's a very protective thing. People, we do that for ourselves to protect ourselves. Although it doesn't always work.
Quick question in chat, Doctor. They want to know, could you please provide an example of attachment empathy lacking due to trauma?
Okay, you mean not developing empathy due to attachment?
Reading the
Okay.
correct is what she says.
Okay, is that correct? So if you are a baby or a young child and you're very in sync with your caregiver, that child will pick up on cues from that adult who's taking care of them. And it's kind of, there's a really good reciprocity that goes on. There's a give and take. The adult will notice whatever the child needs and do their best to take care of that. And in turn, the child starts noticing things about their person. There's, they look at each other eventually, they make faces at each other, there's play, so those are the foundations of how we can understand other people and care to understand other people. Yeah, if you don't get that when you're little, it's gonna be really hard to just come up with that on your own. It doesn't mean it's necessarily too late, but it kind of puts a kid at a disadvantage in that way. Any other questions right now? Okay, other developmental domains affected by trauma. So behavior can be affected, like being aggressive, impulsive. This is an interesting one, difficulties with cause and effect. So if you think about it, if there's stuff that's happening around you that is either unpredictable, that's harmful, that you never know who you can trust or what's going on, it's really hard to figure out cause and effect. Like, if I do this, this will happen. If I don't do this, this will happen. If a child's environment is very unstable, this is a tricky one. So it makes it hard for them to regulate themselves behaviorally. Sometimes kids who have been through trauma will hurt themselves on purpose. They'll self-injure as kind of a way. There's different reasons why people do that. Sometimes people do it because they feel like they deserve it. Sometimes people do it because they just want to feel something else besides their emotional pain. Sometimes people just want to be in control. There's lots of reasons. Those are all the reasons. There's a lot of reasons, but that's something that you might find. It doesn't mean everybody who self-injures has had post-traumatic stress disorder, but it does happen with people who do. Eating disorders, that's another like behavior, like it's like a control thing. Feeling powerless at some stage in your life due to trauma, that's one of the ways that it could show up. It's not always, eating disorders not always related to trauma, but it can be. So there's a lot of research that has shown like a correlation between difficulties with learning and childhood trauma, which makes a lot of sense if you think about it. Going to school and learning stuff is a lot of work. And if your mind is somewhere else and you're experiencing some bad stuff or you're scared, probably not going to really be able to learn as well. Your brain is not going to be freed up to do that as well. So there might be some difficulties with learning, paying attention. Having traumatic memories kind of gets in the way of your attention as well. They've even showed that at certain ages, there can be a decreased level of IQ compared to other people, like other kids their age who have not had trauma, which doesn't mean that it's always going to be like this. That can change because kids grow and they get smarter and all that stuff. But that is one of the things, which again, it kind of fits. So this is really hard. If you think about it, if this happens to a child while they're going through bad stuff, it's like, wow, there's not a whole, like, the positive stuff in their life becomes smaller, possibly. They might really start to think of themselves in a negative way. They're not doing well in school, because that's kind of like a kid's job, is to go to school, right? So that can kind of exacerbate or compound how they're feeling about themselves in the world. Just not feeling good about themselves, maybe feeling unstable about who they are, having a lot of guilt and shame. So again, I kind of want to emphasize again the three areas that you often see in children, adolescents, and adults who have had trauma are feeling somehow responsible, like I feel guilty, I'm bad, I'm shameful, I should have done something about this. That's one, so responsibility. Safety, not feeling safe, not feeling validated, or not having control, not having power. So sometimes you'll see how that shows up in some of these domains with with kids is, really having trouble regulating themselves and their relationships with other people. This is really cheerful topic, okay.
Just quickly, would that also, could it be also like speech delay?
Oh, yeah, absolutely. Absolutely. I'm thinking about, I have one young woman who I'm seeing right now who's really worried about her nephew because her nephew is in a chaotic household and he's not learning how to talk. Yeah. Because there's too much going on in that household for him to really get that reciprocity, to observe and to have, the adults there like talking to him all the time and stuff like that. Yeah. We are gonna get to better stuff in a minute.
Mary Ann, I see that you would like to actually ask the question. If you can unmute for a second, you can go ahead and ask the good doctor.
I'm sorry, I know you've gone over, could you just repeat the last three major developments that you were talking about? Safety and
Oh, yeah, okay. So responsibility,
responsibility.
and that kind of falls into two categories. There's like the category of feeling irreparably harmed or damaged.
Mhm.
And then there's the other side is feeling like you should have done something, like it's your fault.
Yeah, feeling guilty, okay.
And so there's responsibility, safety, and control.
Could you expound on safety, please?
Sure. So feeling unsafe. So if you've been through a situation where you are actually not safe, it's normal for your brain to try to protect you by the next time you get into another situation, for that to just feel unsafe. All of these symptoms actually of post-traumatic stress are a response it's self-preservation actually. It's just your own brain trying to take care of yourself. And at some point it doesn't work. It kind of blows up in your face sometimes, but so that's what it is. So it's kind of like the then goes into the now with like safety. Like something felt really unsafe before and you actually were unsafe, and then that somehow gets pulled into what you're doing now, even if it doesn't apply.
Well,
So
and so
even
also for like adoption and abandonment. And being abandoned twice, let's say, so they're not feeling safe in terms of I don't know, emotional issues, I guess I would say. Is that part of what you're speaking about also?
Can you elaborate on that just a little?
Well, in my situation, I have a daughter that I adopted. So she was abandoned in China, brought her home over here, long time until I was diagnosed with mental illness. So she was raised in really kind of a shitty environment, to excuse my language. And now it's kind of catching up, and she now has estranged herself from me. And somebody was explaining the concept of a feeling of double abandonment. And when I heard unsafe environment, I thought she was talking about our home, which was not that at all, but more about not getting unsafe, not getting a family foundation, not getting, the emotional support that she needed.
Thank you. And that might have been hard for you to share, but thank you for sharing. Yes, so it sounds like a level of, there was something about how she trusted her situation at home, or she felt like she was being heard, something like that. So maybe not being able to keep that relationship or that trust going. Yeah, I think so. Thank you.
I
Yes.
think you kind of covered it, but what about, I'm looking, you know, in the household with all the aggressive behavior and the cutting and what. But there seems to always be the one who is so responsible, the over parentification, and they just kind of hold it together as well. I don't know, sometimes it's.
Yes. So like a super controlled person who's like a so-called hero child and does everything right. Yeah. Yeah, that doesn't mean that that person doesn't have those, like some of the stuff or those feelings that lasting impact as well. That's just how, for them, that's how they dealt with it.
I just think
Yeah.
sometimes they look, they don't get the care that they need because it all looks like they have it so amazingly together.
Yeah, like nothing to see over here. I'm all good. Yeah, I agree. You're right. Yeah, absolutely. Thank you for pointing that out. So she was talking about just how sometimes we overlook kids who are so-called doing well that maybe have the same difficulties. So, okay. Okay, so back to these ACEs, adverse childhood experiences. So here's the stuff that they came up with as far as how it impacted physical health. I mean, it kind of ran the gamut, like hypertension, like cardiac stuff, pulmonary, like COPD, hypertension, heart disease, diabetes, alcohol abuse 8 times more likely in those folks. Generally not living as long as other folks, mental health stuff, depression, increased risk for partner violence or intimate relationship violence, and kind of doing stuff that might not bode well for general health, like if kids start, smoking at an early age or using drugs, or maybe they are having a lot of sex, or something happens with sex, like they get an STD, they get pregnant early. There's just all kinds of stuff that tends to pile up on itself. If you think about it, like somebody in that situation might then have financial stress and then maybe have just more health problems, and maybe just kind of get into this kind of like a hole of just some issues. So things can accumulate. So it's not just, so-called mental, it's definitely physical, it's everywhere in the body. There's a book out there called The Body Keeps the Score, kind of a classic book about different physical things that people go through that are trauma related.
And this is with the 20% that had 3,
So there were 2/3 that had
1.
I don't think this isn't separated with those, but it's like, this is the stuff that happened.
Okay.
And the more, what the study said is the more adverse experiences that they had as a child, the more likely they would have more additional physical stuff. So it's not just, having headaches, it's or whatever, it's some big systemic things. So it's important to really pay attention to this, and for all of us to, kids get treatment, adults get treatment. Okay, so childhood trauma can be acute or chronic, and I've talked about that. It can be little things, big things, stuff that happens over a long period of time, stuff that nobody even thinks to ask, right? Because it doesn't seem like it's a big thing. So everyday adverse experiences can be overlooked. And again, not everybody gets post-traumatic stress disorder or is affected in the same way. There's some things that we all have that can help us. And I'm going to talk about that in a minute. So this is just kind of summarizing what we've talked about. So trauma exerts a powerful effect on child development because of kind of this chain of events. There's cumulative effects of brain development, how it impacts brain development, and then the emotional regulation of that person, how they deal with their own emotions and deal with relationships with other people. And so it kind of builds on itself. Okay, one study said that kids who have a bunch of adverse childhood events can have like a bunch of mental health diagnoses. Yeah, so in other words, it can impact, like say a child has depression, might not just be depression, it might just be kind of like depression because they had trauma, or if they look like they're super anxious, they have trauma. I've worked with adults who have OCD and came from trauma. It was just kind of like how they are managing their world in a very compulsive manner, because of feeling out of control because of something bad that happened to them. So it can kind of like pop up in different ways. I think this, we were talking about this before, like how do you know if it's trauma or if it's something else? Not everything has a trauma underneath, but there's, I think, a lot more than we considered. So not all adverse experiences end up as PTSD. Here's some good stuff that can maybe protect kids. So we think about kind of their developmental age when stuff happened. Generally, the older the kids are, the more they have, more their brains are developed. They might have more coping skills. They might have more people that they know that are around them that can be supportive. If the trauma happened over like a bunch of developmental periods in their life, or maybe just one. So if it's ongoing, that's not as good of a sign, but that can impact. So we think about the degree of the trauma, the relationship to the person who is maybe involved with the trauma. That's really important if it was like somebody close to you or somebody not. There's different kinds of trauma, and we're going to talk about protective factors. Okay, so all these things impact like how the trauma can develop and how bad it might be. Okay.
A question over here.
Yes. Oh, thank you.
Do you feel like early intervention and treatment can impact and influence the degree of trauma?
Yes, I do, especially if you include the caregivers in that treatment.
I couldn't hear the question.
So she said, this early intervention, would that be helpful? And I think yes, especially when the caregivers are involved with that. Because sometimes the caregivers need help too, right? They need help, and they also need, the earlier the intervention, the more that you can help validate the child, teach the child how to cope with what they're going through, help them identify their feelings and what to do about them, and then involve their caregivers to be aware and to be, maybe some skills or some coping skills for themselves.
People, adults as well as teenagers, experience trauma on social media.
Yes. I didn't even bring that up. I should redo my slides and just have social media like it's like 10 slides. Yes. Yeah, I mean, it's such an opportunity for bullying and ostracization and I don't know, the whole ghosting people or not, I don't know. There's so many different ways that somebody can feel traumatized on social media, and also witnessing things that somebody puts on there that's not supposed to be on there, and seeing that is awful as well. So like actually witnessing a bad event happen that somebody taped or videoed and put on there. Yeah, absolutely. I'm sure we could come up with lots of different things. Yeah, that can definitely impact a person's mental health. Definitely, for sure.
Could getting attached to like TV show characters or both characters versus friends or things be considered attachment disorder?
Well, if they're attached to your someone in like your family or somebody who's taking care of you, I would say not necessarily. that it might be a person who, gets really attached to those things because it provides some kind of outlet, or it could be kind of an avoidance, or it could feel like this is how I would really want my people to be. It could be if they're kind of reenacting that with like other characters. But people can do that, I think, and still be attached to their parents or whoever raised them as well. Yeah, okay. I know. So she said, if people, if someone gets attached to people, in like a book or a movie or something like that, like really have like a fantasy, really rich fantasy life with characters, fictional characters, would that indicate, poor attachment? So not necessarily. Yeah. Yes.
Just a couple of quick questions if we could, Dr. One is, they said, what do you mean by ghosting event?
Ghosting. So like when someone is your friend and then all of a sudden they ignore you entirely, pretend that you're not there, and that can just add to a lot of distress. I think especially for teenagers and kids.
Perfect.
Yeah.
So the next one was, could you discuss an effective intervention when there's highly suspected ongoing trauma, but you can't confirm it, but there's a long-term exposure contact in a therapeutic environment with kids who are closed in and not disclosing anything?
So how would a person be able to tell someone that they're like that the child would be experiencing trauma, but the child's not disclosing the trauma?
Sarah, can you unmute for a moment and maybe explain that a little bit better than the way I read it from your chat?
Absolutely. So basically what I'm kind of pushing towards is if there's a suspicion of abuse or neglect happening in the home, and because of ongoing, like a file, 3 inches thick on a kid, and multiple siblings that are within the same environment that have the same exposure to the same therapeutic interventions at a school, and they're highly suspect of ongoing trauma and abuse, the kids are so closed up that you're not getting to the point with them where they confess to something going on, but your suspicions are out the roof. Things that you can do to encourage them to share, for one, and on top of that, besides just providing a safe environment, things that could be done besides checking in, besides a ton of reports of suspicion, that could help them feel more comfortable to open up when there's this intensely high suspicion something is ongoing at home.
Okay. Are you a school-based therapist, or?
Yes.
You are, okay.
I'm
So
I'm a school-based nurse and work really, really intensely with mental health.
Okay. So you have kids that come to you and you're thinking, it sounds especially like one family with lots of kids, and you think that something's happening to them and no one's talking about it.
Yeah, like counselors, we all are very, very suspicious of this situation. And it's not just like, vague suspicion. There's like multiple counts of heavily acts that are acting out in a sexual way towards other people, and towards other children and students at school. So the suspicions are very particular to sexual abuse suspicion.
Yeah. Has anyone reported anything to the child services yet? It sounds like yes, or just curious.
Yeah, I mean, there's been time because of everyone's concern for them, but because there's been a lot of suggestions of in-home intervention, the parent has, and which has raised our suspension, has always said no to it over and over and over again, even though the children are like, one of them specifically is doing really poorly in school.
Yeah.
It sounds like to me that the kids have to totally remove order for them to expose.
Yeah.
Because if you keep them in that same environment, they're constantly going back every day, they're not gonna say a word. Now,
Yeah.
I don't know, I really, no, I'm not gonna assume, but if you remember the family, I think they were, well, they wore, certain clothes, they was in a rural area. Just about a couple of years ago, where the kids were being abused, the parents was abusing them, and they were isolated for years, probably, I believe, around 10 years, maybe 14, well, 17, because there was an older sister that was able to get out of that house who exposed them. Do you remember that? That was about 2 years ago. Yes. That's how she was able to expose them, because she ran away. But as long as they're in that environment, they're afraid to say anything. They're not gonna say anything to anybody, even if someone had just come to the house to visit for a short period of time. They're gonna act like nothing is going on, but there's something going on for sure, for certain.
Yeah.
You gotta remove the kids out of that environment in order for them to.
Yeah, I completely agree. It's just that the situation is such that nothing that has been said that has been highly suspicious, because there's never been a point at which a child has disclosed anything specific. There's just all of this, like, as a counselor, you know what you're looking at. And so you gotta have evidence. And so it's like this very, very difficult situation, because you can't take a kid out of a home without hard evidence. You know what I mean? So
Right.
just trying to figure out how to be supportive and to give them the best tools possible to get them to feel as comfortable as possible opening up, so that key piece of evidence, like, that gets to pull the trigger in the process is what I'm asking. Like, what are some ways to help them feel more comfortable to talk when they're terrified of the repercussions, basically?
That's true, but yeah, I have a suggestion. Hold on. Thank you. One suggestion that I have that I've become very interested in lately is play therapy. I know a lot of kids, we do referrals for like services, support services and things like that. And they can find a therapist that they feel comfortable with opening up to, kind of, sort of. But it takes time to build that rapport. But I know more recently, seeing kids do play therapy and being able to actually express what's going on in their minds, in their homes, that's become very helpful in our field in particular. So maybe doing a referral to like a play therapist and having them go and attend a few sessions, and it might actually make them comfortable enough to begin to reveal some things through play therapy. Okay.
Thank you.
But also, just one thing that I want to throw in there is that, just having worked at a child advocacy center, where they have social workers who do very specific interviews for kids who have reported something. You have to be really careful. You don't want to suggest anything to the child, and even if you think it's going on, during that play therapy, it should be really like non-directive, I think, for them. You don't want to plant any seeds or because that could actually interfere with any investigation that could eventually have. And we don't want anything to contaminate that. So it sounds like you're in a really tough spot, like a really tough spot. I feel terrible for those kids and you guys trying to help. So.
I appreciate it. It's just one of those things that when it's like you can read the writing on the wall, and you feel like at any point it should be your job, and you just want to like grab those kids up and like rescue them from that environment, and you feel like you are absolutely failing them at every second because the suspicions were so high. So yeah, I appreciate your feedback.
Thank you.
Okay. Let's talk about protective factors. So that means stuff that kids have inside of them and outside of them that will kind of buffer any of like the negative stuff about trauma. So internal resilience, which I guess that's kind of a tricky thing to even define in a way, but somehow being able to, I guess, not just filter out all the good stuff, but be able to like attend to the good stuff. Person with resilience has that, and that can actually be taught. So parental responses, I would probably give this the number one thing. Parental response to trauma is the most important thing for a kid. So if it's the parent that's doing the trauma, not so great. But for example, if you have a child who's been hurt by another adult, and then they tell their mom or dad, and their mom and dad says, okay, I believe you, let's go do something about it. That's gonna turn out probably pretty well compared to somebody whose parents are like, either don't wanna hear it, are too fragile themselves to really hear and do anything about it, or just flat out don't believe them. So, and I've actually seen it in adults, where I have adults who've been through horrific things, and I wish I could take that, 35-year-old back to like age 8, and then take their mom and like shake the mom and be like, do something about it, listen to her, because that's the trauma. It's not just like what happened to the kid, but what the adults around them do about it. If they believe them and if they do something about it, protect them. Really important. So that can be a very protective factor that can really help a lot. Having all kinds of social support, safety. This includes teachers and counselors and neighbors and people at church or whoever, like all kinds of coaches. A child's natural talents or capacities, which could get them involved in fun stuff, where they find more support and they feel more confident. IQ actually is part of this because that helps build their experiences in a positive way. And studies have shown that boys tend to be a little more fragile than girls as far as, I don't know, just inherently, which is, it's kind of interesting because we're always telling our boys to not, yeah, they're the strong ones. Okay, so we think about treatment of post-traumatic stress for kids. There's post-traumatic stress disorder and trauma and other stressor-related disorders are definitely treatable. Absolutely 100% treatable, which is the good news. So I'm going to talk about a couple different things to do with kids. I think could be helpful. Some of you guys, I can tell, are professionals in hearing, probably already do these things. So I'm going to talk about it anyway. One of them is called trauma-focused cognitive behavioral therapy. And that is actually a type of therapy that's very specific. So it's cognitive behavioral therapy, but it's actually like a curriculum that's very specific and you get training in it and stuff. But so I'm going to show you the components of this because it's really important. I think this is just a really good basis for any kind of therapy, any therapy that anyone would need for trauma. So, so there's a psychoeducation part. So that means explaining to the child and the parents like what trauma is and what it looks like in their child. Because usually they might bring in the kid and there's stuff going on that they're saying like, oh, he's anxious or he's depressed or he's like doing all this other stuff. And so to educate on what trauma can look like can be really helpful, can be really validating for that child and the parents. Helping with parenting skills. So parents, most of the time I think are really, really doing their best. They really are, but they might need help in managing their own emotions, helping their child manage emotions and behaviors. I always think, usually when somebody comes in for therapy, a lot of times they just want to like tell you everything. And if a kid doesn't do that, I think it's actually okay, because what we really want to do before anybody tells all their stuff is to make sure that they feel capable of doing that without getting too upset. So the first thing that you do is really teach like a child how to do relaxation for their body, how to feel better in their body. The same thing with adults, calming skills, being able to tap into positive things, instead of like bad stuff, so that they can like access something in their minds that feels really positive, can help calm them. Really important to be able to do that before you talk about your trauma. So there's that, identifying your emotions and being able to express them in a healthy way. That's something that we can teach kids, part of this TFCBT. Helping them learn how their thoughts impact how they feel and what they do. So we teach them about thoughts and how they can help manage their thoughts in a way that feels better. And the trauma narrative, so that's the part where the child in some way, if you play, or they can write or draw or something, will tell their story about what happened. But it's not just that, it's also processing that, like, what were you feeling? What were you thinking? What's the worst part? Let's talk about the worst part. And doing that, it's kind of like it's an exposure so that they can talk about it, and then it feels less scary, but it's also in real life, how to manage how you're feeling when you talk about it. So it can really help kids feel better. Mastery of trauma reminders, that's like, what are you gonna do if you're out somewhere and this thing happens, and then all of a sudden you remember bad stuff? What are you gonna do to help yourself? That's super important. And then safety planning, keeping yourself safe in a reasonable way so that they feel better. And encouraging them to know that not everything is necessarily scary, but safety you need to plan for safety in some things. So that is those are the therapeutic tasks of that kind of therapy, which I think are generally in a lot of different therapies for everyone. Any questions about that one? I think I only have like 8 minutes. Few minutes, okay. And the next I'm going to talk about, just super quick, EMDR is also, can be used with kids. This is eye movement desensitization and reprocessing. I could spend a whole time talking just about EMDR. Super complicated to talk about in like 1 minute. But anyway, what it does is it helps somebody's brain actually process the trauma so that it's kind of like cleared out and neutralized. So it's kind of like, it happened to me, but I'm not as upset about it. And it can be very helpful. So this is actually working with the brain using eye movements. It's usually like dual attention. So somebody's thinking about it and they're watching something, so their eyes move back and forth, and that stimulates the brain to process things that are stuck, traumatic things. So sounds like voodoo. It's actually not voodoo. Yes. Yeah. Yeah, they can. They actually can. Okay. Okay. That's kind of basically what I've got. Mindfulness, I think it's really important with trauma is to help kids understand that stuff that happened then isn't necessarily what's happening right now, although with kids sometimes it is, depending if it's a chronic situation, but being able to just kind of know that that stuff happened, that you don't have to avoid it, that you can be next to it and it's going to be okay. That's kind of what we're going for, a lofty goal. Okay. Physical care, emotional care, spiritual care, and sometimes medication can be helpful for these kids as well. They're having a lot of symptoms, but I would say, and all the psychiatrists I work with will say this too, the most important thing for post-traumatic stress is therapy. Medication can be good, but therapy is better. Yeah. Yep. Okay, we have a few more minutes for questions. You guys have been great. Thank you so much for being open and asking such great questions. It's really been a joy to talk to you.
My ex-husband, when I've taken my son to therapy, he has requested an account of what we're talking about, like during the therapy session. It was granted that because of the parent. And so I tried to take my son to a different therapist that, you know, and I explained to that therapist, I don't want my husband to be able to, ex-husband to be able to get that. I want it to be safe for Brody. And then she refused to treat because there, you know, the legal is that he can still get a written account of what was talked about. How do I get around that to get? So I'm gonna try.
What was it?
You need a court order. Yeah. Lawyer.
Although technically, only one parent has to take the kid to therapy. Like it doesn't, you don't actually need the approval of both parents.
It depends what's in
Yeah.
this year parenting plan. And some people, I do a lot of divorce work, and the way a shared parenting plan is crafted often will limit that kind of confidentiality. And so you probably need to go back and look at your plan and see if there's something in it that requires that you be able to access that. And if there is, then you need a lawyer to change it. You have to mediate it.
Are these like psychotherapy notes that are being shared? Or is this like a summary?
No, he's asking for a
Transcript?
transcript, yeah.
Wow, okay,
He's super controlling.
yeah. It doesn't seem like something that the therapist should have to provide. We do not, we do not release psychotherapy notes at Lindner, and
Did research it, she said that by law, she has, because he has very limited parenting rights.
Yeah.
He only has every other weekend, one day, one night,
yeah,
one evening through the weekend. He actually takes them to a different therapist, because he was ordered by court to do relationship reconciliation therapy. But my son has said that at that therapist, his dad lies about him to the therapist.
okay.
So I wanted to take him to his own therapist, so he'd have a safe person to talk to process what's going on with the therapist.
Yeah, so this is part of the trauma for the child. It's going on in real time.
It's
Yeah.
killing me, it's killing me, like, I just can't believe that he won't let his son have his
That
safe
time,
person.
yeah.
And there's nothing I can do about it.
What about those two therapists? Can they get together and talk about this?
Yeah, I don't know. I've never, let anybody see any kind of notes
Well, she said the judge
or,
can,
you
judge
know.
can order her to give the transcript.
Okay. That sounds really difficult. Yeah, Yeah.
Sure can,
Right.
yeah.
sure can.
So, yeah.
And if the father is the issue with why your son is going through what he's going through, yes, the judge can definitely order that.
I'll just go to my lawyer.
Yeah.
Yeah,
So that
Yeah.
means something.
There you go.
Because that's interfering with his healing.
yeah,
For sure, his father's constantly trying to
This question,
manipulate, controlling, yeah, he's gotta be able to heal.
It's a horrible situation.
yeah.
I have a question about, you had mentioned my question is about racial trauma. So you had mentioned like transgenerational and do you see a lot of racial trauma in children that are experiencing, what their parents had experienced and like a societal level? Or is that something that, can it be like a compounding factor?
Compounding factor for just other things or?
Yeah, as like a risk factor, because I know you had gender and IQ as protective. Could something like being in the racial minority be a compounding factor that can add to it?
I don't know what, I don't know off the top of my head any research about that. I'm just thinking of my own experiences though. And I think it can definitely play a role in someone's experience because like it's real, right? I mean, things happen and it's could be part of what happens to a person that is harmful for them. So, yes, absolutely. I mean, I've worked with tons of kids who've been through that. Yeah. Okay, yes.
Could you briefly just expound a little bit about medical trauma?
Medical trauma. Okay, so, yeah, that's a big one. So being hurt, either being hurt, people go and get hurt by doctors, right? That can happen sometimes. There can be for kids, I think, if they have something that happens, that they need medical treatment. Sometimes even if the medical treatment is like absolutely great, it's scary for them. That can just be a source of trauma for kids that I think a lot of times people don't really ask about. It can be painful. There could be a recovery period that's difficult, makes them feel different from other kids. Maybe they miss out on stuff. It can be difficult. So, but that's also where those protective factors can come in sometimes to help buffer that for kids. Yeah. One more question. Yes, yes.
Question. Is there such a thing as a class or support group for parents who have a child with trauma or anxiety, or depression? I mean, you said that's a piece of their healing is if we can do the right things. And I just wonder if something like that exists.
I would love to.
Probably NAMI, family meetings.
What?
NAMI.
It's one of the
Online. Everything is online.
Yeah.
It'd be nice to have a person-to-person
They have,
support group,
Yeah.
you know?
they have something called the Parent Project. I don't know if y'all are familiar, Butler County, Ohio, if you look it up.
Okay.
The Parent Project, they do in-person parenting classes for kids and parents